All right, so I'm going in to see my first patient today. There's a bug. As we say, my jacket is very important. Even when me a burn up, even when the sun is like very, very hot outside, I have to still wear my jacket because this protects me, especially if a patient smoke, or not even if a patient smoke only, but yeah, the only thing we need is a hair covering. That's the only thing that is missing. And then I have my pair of gloves. I put my mask on like so. Sometimes the place is too hot, so can't put it on, but it's pretty cool now. Then I'm gonna go. Patient come outside looking, so can't stay here making no TikTok video. Alright, so I will see you guys in a bit. So a lot of times, when you go out as house call nurse practitioner or as a nurse, you find yourself going above and beyond. Not saying that all the time I do go above and beyond, but there are days when I do have to spend a little extra time waiting for patients. Like I had a patient earlier that was not available for her visit at home. So I ended up spending like 15 minutes at her house just to wait until she get in for the appointment, because this was the first time I'm meeting her. And you'll realize that sometimes these patients overbook appointments and they don't even remember, because sometimes they're elderly folks, and so you might realize you show for their visit because you had a scheduled appointment, but you realize that they're not home, and so you just have to kind of wait, just be a little bit patient for these folks. The other thing you might realize is that sometimes you might go in to see the patients and they'll request for you to come in a little bit earlier than usual. And as a house call nurse practitioner or as a nurse practitioner, one thing you like about your job is the fact that you have the flexibility. You get to go in for work sometimes 8:30, 9 o'clock, and you leave at 4:30, 5 o'clock sometimes. Sometimes you'll hear these patients asking you to come in for appointments at 7 o'clock in the morning. Sometimes they'll tell you they want you to come in for appointments at 5 o'clock in the evening. And you just have to nicely say to them that, this is the time that the office do open and this is the time that you're available, and they will work around it. I'm not saying that all the time, you're not going to be able to facilitate them for some of their visit time, because definitely some of them have appointment and probably, it's almost end of the month or something, depending on what's going on. So you might find out that you have to work with 1 and 2 of them some days. But when you realize there is going to be consistency with the time period, you have to kind of tell them, no, you won't be able to do this all the time. You're not going to be able to see them at 3 o'clock or 5 o'clock in the evening. Because me personally, I finish working at 2 o'clock most days. I start working at 9 o'clock, 9:30 thereabout, and I try finishing at 2 o'clock. If I do work until like 3 o'clock, it's because something happened and I am out there. But just go ahead and let them know this is the time period that the office do open, or regular clinic offices do open, and this is the time period you'll be able to get there. And one thing I do is try to put it on their chart, so that way at least the next time when I'm coming, I can always try to see them at the earliest time, as long as it's not gonna get me out of my regular route to getting to see the other patients. And as I say, once you talk with these patients, sometimes they have understanding, sometimes they don't, but some days it's just like that. On other days, you might find out sometimes you might try calling the patients ahead of time, trying to get them to, confirm that they're home before you get to their appointment, and you realize they don't answer. Some of these patients don't have cell phones available, and so that is one of the biggest challenges as a host call nurse practitioner. You're not able to call them and let them know that you're 15 minutes out or 30 minutes. So rather than going ahead and just missing them and not seeing them on the day, I personally just drive over to their house and check to see if they're there. If it's a case where, when you go there, they're not there, then that's different. I might not go back and see them a second time. Or if I'm in close proximity, then definitely I will try to go ahead and see them. But if it's going to be something that I'm going to have to drive 15-20 minutes to go and check to see if they're there a second time or a second visit, then that's a no-no for me. You understand? So definitely you have to just kind of understand that not all the patients are going to be home at the time for the evaluation. Not all of them have, cell phones, and it is just you being a person that you are, if you are kind enough to go ahead and try to see if you can assist them in whatever way you see it possible. If it is a case where you're going to be driving 5 minutes extra, 15 minutes extra, or you're going to spend the extra 5 minutes or 10 minutes until they get to your location in order for them to get the visit. And basically, that's just a day in the life for me, starting out my shift for my day to day. I have about 5 more patients that I'm going to be seeing. They are not as bad because I've already seen them, so the visits are going to be a little bit shorter because these are follow-up visits to, me ordering some testing and their results coming back abnormal. So we're going in to just see them and discuss those results and plans moving forward. Let me know what kind of nurse practitioner you are in terms of if you're the kind of person that will wait or not, or will show up or not, so I can know, how to move forward, even though I don't think it's going to change anything regarding how I approach, my patient care. It's just a little bit different and I like it. I'm not losing out, and at the end of the day, I feel, like I'm doing something for my patient. So that's all. All right. So I'm going to share with you a few things or tips that I feel as though, makes us look at life as being challenging. And the first one is that we're dealing with chronic stress. When it comes on to stress related to family members, stress related to money, finances, stress related to work, those are things that causes us to feel as though life is very challenging. The other thing is when you're under pressure, a lot of us tend to feel as though we're under pressure when it comes on to social media. If you're not the kind of person that is very strong, social media might just lead you down the wrong path. You have some persons who do use social media for the positive aspect of it, but you have some persons who are under pressure because they see themselves, not achieving certain things in life. They compare themselves with other persons. They are trying to level up, and so they try to do it not in the correct way. They try to achieve things a little bit different than other persons. So because of social media, sometimes that is fueling all of this, you tend to find out that peer pressure is one of those major factors that cause persons to feel as though life is very challenging for them. So another thing is a lot of persons tend to lack boundaries. When it comes on to work, we tend to say yes to everything. So even when we know that it is time for self-care, for personal growth, we still go ahead and say yes to everything. And so sometimes you're just feeling overworked, you're feeling exhausted and tired, and that can cause you to feel as though life is even more challenging than ever. Another thing is when it comes on to mental health, a lot of persons tend to suffer from anxiety, depression, they're feeling burnout, and eventually, all of that accumulates and tend to find persons feeling as though, life is challenging. Some persons might go as far as feeling as though they're having suicidal ideations, homicidal ideations. But before we actually reach that area, let us try to see if we can find persons to talk to, get the necessary help to prevent it from reaching that far. We tend to often find ourselves comparing ourselves to another person. So another person's journey might just be a little bit farther than ours. And so sometimes we're trying to play catch up, or we're trying to compare ourselves and tell ourselves that we're not doing good or that person is doing better than us. And so we need to try to see if we can be a little bit more positive and be optimistic and try not to be thinking about, the other person. Stay in your own lane and just go at your slow pace until you reach your goals in life. And I do hope that these tips were very beneficial, because I know a lot of times, we're out there and we feel as though we're not achieving, we're underachieving, all of those things. But I do hope that, we will just reflect on certain things that we're going through or dealing with in life and just look at it to say, this is just my journey. You understand? And try not to make it be a case where eventually it causes you to start go cuckoo. Yeah. Don't let it be a case where it start to affect you mentally, but try to see if we can navigate, reverse, all of these things and look at the positive in life rather than think that life is always challenging. But I do hope you guys will have a wonderful day. Go ahead and follow me here on TikTok at ThinkNursing1. Follow me on YouTube at ThinkNursing. It's one word. And just remember to like, share, comment, and be a part of the channel. And thank you so much for tuning in. And I do hope you will have a wonderful day. Until then, peace out. All right, so I am just waiting to go in to see another patient. I don't want to go down to where the actual patient is. I know the patient is in there, but it's a little bit, in the back of the yard. So I don't really want to go down there. I'll wait until somebody comes out to the front. So I'll call the office just to kind of get that going for me. And then I will find out for future visits if they want me to just go straight down or they want me to stay at the front. So that's it. But I'm on my last patient for the day. It's not bad out. The sun is still hot. Alright, sun is still hot out here. So, and it is after 3. It's 3:15 p.m. so it's not that bad. So I'm gonna go home and do these 7 charts, and then I'm gonna go to the gym at 6 o'clock. Probably only end up finishing about 4 charts, but I'll come back home and do the remainder of the charts, and that's it. But 4 is better than none. Alright, yeah. Alright, I'm still waiting on the call for this patient. So, so sometimes us as healthcare workers, we kind of set the trend for other persons to feel as though it is normal for persons who are not wanting to do something to continue with the trend that you set. Meaning, if you are a nurse that don't wear a glove and don't wear a mask and sit down in every house that you go in, the patients that we're seeing in the house call service or the house call setting sometimes feel as though everybody else after them should be doing the same thing. And why I say that is because I told you about a situation where I had a patient complaining about me wearing mask and glove into their house. And that wasn't the first, second, third, or fourth time I'm having a situation like that. And I have to explain to them it's either or either. So anyways, today I went into a house, and may I tell you, based on the notes that I was reading from the admission nurse, it was a really good notes, because she explained everything down to the T. You understand? She explained everything in so much detail where I was able to go in very, very prepared for this patient. So when I was going in, the only thing I never had was a gown. But in terms of my shoe, my mask, and my glove, yes, I have it on. And the bag with less items, I had it in place just because of the description of the home. So when I went in, I saw another nurse practitioner in the home. She wasn't wearing a mask. She wasn't wearing a glove. She had her tablet on the carpet that has a lot of hair and dog droppings. She had her book on the carpet. She had her hand without a glove doing this lady's dressing. And when I tell you the home is in a deplorable condition, the good thing about it is that she had her little stool, so she was able to sit. But everything else you're talking about is on the ground. Every single thing else is on the floor of that patient. I'm not saying you have to go and scorn everybody, but dirt is dirt, infection is infection, contamination is contamination. Then lo and behold, I saw her, because I'm waiting for her to finish her evaluation, because that was so distracting for me. It was so distracting for me because me standing in there looking like, okay. So I waited for her to finish her evaluation, and then I saw her sanitizing down her hand really, really good. After that, she went ahead and picked up her tablet off the floor, put it under her arm. She went and picked up her book, finished writing her little notes. Then she picked up the bag that was supposed to put her dressing, the used dressing in. She picked up those and put it in the bag, and then she locked the bag. Remember, so she sanitized her hand a long time already, So tell me, how does that go? How it work? You understand? And so me just look at it for say, when persons see one person doing something like that and they feel as though because you're in the health field, or that person is in the health field and is able to do it, and it seems as though they're okay with it, everybody else come after supposed to be following in the footstep of those person. Because this person is saying to me, why are you wearing a mask, nurse? And I'm like, well, I just wear my mask in all my patients' home. You understand? Just because you have persons out there who are doing things differently. She never asked me why I'm wearing a glove, which is good. You understand? But it is a standard of practice for me. I'm going in person's home, so I am going to be wearing my mask. I'm going to be wearing my glove. We go out there, we just need to be mindful that, you see, whatever trend you go out there and set in, or whatever example you're going out there to set, make sure it's a good example, because then you're going to realize that patients are going to want you to be doing certain things that they see other persons or other providers coming into their home and be doing, and they will find you as being the fault or the problem when it comes on to the visitations. Because I tell you, I was so surprised when I saw the tablet, the book, everything just throw down on the ground on this carpet. And in my mind, I'm like, no, sir. How is this even possible? How is it even possible? So, you know, word to the wise, when you go out there, make sure you have your little wipes, have your hand sanitizer, because she seems to have everything. But the one thing that she is missing is the fact that when it comes on to her safety, she's not remembering that. Because if you're not thinking one step ahead, you're going to bring home dog stool on your belongings. You're going to put it in your bag. You're going to go and take it and put it on your steering. You understand? Just because of the mere fact that you're not thinking about the environment that you're in. You're not thinking about it. You understand? You're not thinking about it, and say you introduce other things, and so comes we get sick and end up in a hospital and all them stuff there. Because we are not practicing what we're preaching. You can hand wash, you can don your glove, you put on your mask, you prepare yourself and protect yourself first. Protect your belongings first. Because you need to continue with your job. You need to continue making money. You need to continue saving life. And if you're not saving your life in terms of your health, making sure that your health is, you know, optimal, good. If you're not taking care of yourself, you're not going to be able to take care of the other patients, them. You're not going to be able to do that, you know. So me tell you, it was so frightening. Like, I am there and I'm wondering, okay, then is this nurse even serious? Is she even serious? It's just concerning for me. You know, it's just concerning for me, for her, that for somebody that is doing house call service or even doing wound care, we're not taking that extra step to make sure we're protecting ourselves when we go out there. Because those wound have different bacteria in there. You know, some of the bacteria, them take forever to get treated. You're talking about MRSA. You're talking about some deadly, you understand, infections out there that people are suffering with and dealing with on a daily basis. Them can't get over it. They have wounds for days, decades. But yet still we're out there playing dolly house. I don't know if I'm doing too much. And, you know, just let me know what you think on it. But it was just something that is surprising for me. And I just wanted to share it because, as I said, when you go out there, you have to be prepared. You have to be prepared. When you're doing wound care, it's important for you to go out there and be prepared. You need your gloves. You need your gloves. I find myself driving 30 minutes to go and get a mask for patients because I'm going in there because me not likes the patients without a mask on. Because a lot of these patients home, they smoke, they cough. It not smell good some days. So I drive 30 minutes from a patient's home when I realize that there is no mask in my car, and go to a Walmart or CVS to get mask and then drive the 30 minutes, come back. Because if that is the way for me to protect myself, I'm going to go ahead and do it. And so for us as nurse practitioners, as home health nurses, start with that as well. Start with protecting yourself. Make sure you're not going out anybody's house and just sit down just like that. Because you're thinking about the little things that you can't see. We're thinking about the germs, the bacteria, the contamination, the infections that can arise from us being in their environment sometimes. All right? Enjoy your day. All right, so someone sent me a message regarding, you know, my bachelor's of science that I obtained in Jamaica. Did I have to do any additional courses here in the state? And the answer to that is no. So my bachelor's of science is internationally recognized. So the only thing I needed to do prior to coming to the state was the NCLEX exam. So just like how you do the RENR or the regional exam for nursing to become a registered nurse in the Caribbean, I had to do the NCLEX to get qualified to work here in the state as a nurse. The only thing that I needed outside of my bachelor's were additional certifications. So, for example, I'm working in the emergency room, then I would go ahead and get my TNCC, which is the trauma nursing core course. And also, you'll get your PALS, your ENPC, ACLS, BLS, and ACLS. So all of those little additional courses you definitely have to take. But in terms of my bachelor's of science in nursing, I never needed to do anything extra, because all my courses that I did in Jamaica, the clinical hours that I had done prior to, coming to the States, were equivalent to the US system here. So I never needed to do anything additional. But if you're a nurse and you're thinking about coming to the state, the first thing I would say is make sure you have your bachelor's of science or your associate of science. Also, go ahead and get your NCLEX done, and then from there you can apply for a job. I hope this was beneficial to you, whoever is asking. And if you're in a position where you're thinking about, wanting to come to the States and you're just questioning that, then that is just my, honest opinion or my experience with transition to the States here as a nurse. All right, so why I say that you can make more money doing house call visits when you do your own billing and coding is because of the fact that, so for example, if you have a company that is paying you per patient and they have persons in the office that are doing additional things. So for example, when you go ahead and see your patient for that month, you'll get your pay and that's it. Sometimes these companies or providers, they don't want to pay you for any additional contact with the patient. So for example, they have lab results to discuss. Sometimes they'll tell you that no, they don't want you to do that. They have somebody else who does it. So you only get your one little money for the month and that's it for that patient. When you do your own billing with some companies, you will find out that you have more control over what you're doing. So when you do order your test, you're going to be eager, you're going to be, looking out for your results so you can go ahead and decide whether or not you're going to do an in-person visit with that patient again, or you're going to do a televisit to discuss the results depending on what is going on. It's the same thing when it's time to get your annual visit, your annual wellness visit for that patient going. You can always go ahead and set up your appointments to make sure that you do that. Every time that they have a concern, you can always just go ahead, put in your encounter, do your prescription, do your bill, and send it off, and that's it. Because as I say, if you make money, the company make money. If you're not making the money, the company ain't making the money. You understand? So it's a win-win situations for both persons. And if you're not in the health field and you're saying, oh, but you're not supposed to be billing the patient this, that amount of time, just imagine those patients are coming to the emergency room 5 times per month for the same concern. They've had multiple testing done. They are being billed as well. So it's no different for us as house call nurse practitioners when these patients do call regarding certain concerns that they're having, and we're having to send out an order for x-ray, we're having to send out an order for a urine test, blood work, prescriptions. It is the same thing that we're doing. We are treating the patient, so it comes with a cost. All right, so don't feel as though what we're doing is wrong, because it's not wrong. We're just making sure that what we're doing as house call nurse practitioners, we're actually being paid for it, because we're doing work on behalf of those patients. All right, so hence why I say you can actually make more money whenever you do your own billing and coding as a house call nurse practitioner, rather than when the company go ahead and pay you one flat rate as a house call nurse practitioner, and then they take on the responsibility of any other concerns that the patient have throughout the month. But if you do have any concerns, feel free to go ahead and leave it in the comment box below, and I will definitely answer that as best as possible. And from there, we can always go ahead and just chit chat, ask the question, and me answer them as best as I possibly can. All right, until then, I will see you in the next video. Remember to go ahead and subscribe to my YouTube page at ThinkNursing, and follow me here on TikTok at ThinkNursing1, where I share just about everything related to nursing, travel, and lifestyle. Nursing in terms of registered nursing, emergency room nursing, and a nurse practitioner or a house call nurse practitioner.